All right. We'll go ahead and get started because we know time is important, and we're so thankful that you're giving us an hour of your time today. These are just a few of the babies saved with Count the Kicks that we like to start off with, some of those smiling baby faces that we love so very much. And this is why we're here. This is why we're doing what we do today, and why you're here to learn more about Count the Kicks and how you can make a difference. First and foremost, thank you so much to the Anthem Blue Cross Foundation for California. It's because of a grant opportunity with them that we are able to provide free materials in LA County and San Bernardino County. So we're so thankful for this partnership with Anthem Blue Cross Foundation for California. My name is Megan Ockett. I am the program director with Healthy Birthday, the nonprofit that created Count the Kicks. I've been with the organization for about 4 years. My background is in public health. I've been in public health for about 15 years. I am very passionate about prevention and education, and I love maternal child health. So I love having these types of conversations and talking to people like you all and Roxanne, and just sharing this information because it's so important and critical. And you're the boots on the ground that are going to be implementing this. We're just the ones giving you the information. So I'll turn it over to my co-presenter today. I'm super happy to be here today with Roxanne. Roxanne, would you like to introduce yourself?
Yeah, hi, I'm Roxanne McAllister. I'm a nurse ambassador for Count the Kicks. So it's a volunteer position. I've been volunteering with them for about a year now. And I am currently a travel nurse. I have been a nurse for about 5 years, and I've been in labor and delivery for the most part. I'm super passionate about maternal and infant care, just educating, empowering, and helping just to have the most positive birth outcomes as possible. So that's why I'm a part of Count the Kicks, and I'm excited to share more with you today.
Thanks, Roxanne. And Roxanne just moved to LA County from North Carolina, right? So that's
Yes.
yeah. So you'll have to welcome her for that. So before we jump in, I want to share this video to learn more about Count the Kicks and the impact it can have. So let's watch. There is a slight delay, but it's just buffering. It's okay.
We're going to turn now to that GMA parenting alert about a free app a mother says helped save her baby's life by tracking how often she kicked. ABC's Diane Macedo is here with that story. What is this all about?
So this mother says that everything was completely normal in her pregnancy until one day, thanks to this app, she noticed that something was off. Well, it turns out her baby was in real trouble. For Emily and Jeremy Ecoff and 2-year-old Liam,
oh, nice.
Life with their new baby Ruby is extra precious.
We have a healthy baby girl, and we could have had a burial instead.
Ruby is lucky to be alive, and her mom says that's largely thanks to an app. The free app called Count the Kicks aims to prevent stillborn deaths by helping moms record their baby's movements.
You can just tap the baby's footprint every time you feel a movement. A movement could be a kick, a roll, or a jab.
Used at the same time every day, the app tracks how long it takes to reach 10 kicks, helping mom learn what's normal for her baby.
And we also send calendar reminders and text reminders so that moms are reminded to do it once a day in the 3rd trimester.
It's just one of a growing number of apps helping parents through pregnancy and labor. For the Ecoffs, everything was going smoothly until one day last month.
The kicks were not happening as frequently as they usually did. And when she did move, it was really like soft, subtle, not like hard kicks like normal.
Emily knew from the app that her baby normally kicked 10 times in under 10 minutes. So when she only logged 3 kicks in an hour, she rushed to the hospital.
All of a sudden, they came in and said, you're going to have an emergency C-section.
The umbilical cord had wrapped around the baby 3 times, limiting her movement. Doctors delivered Ruby just in the nick of time.
Not only has Ruby been saved, but potential generations have been saved.
She sleeps about 23 hours a day.
4 weeks later, Ruby is now home, healthy, and sleeping like a baby. Doesn't get much cuter than that. Now, the app was made in Iowa, which is where that family is from, but the creators say it's now spreading nationwide, thanks in part to Ruby. Since the news of her birth, the app has gained more than 5,000 new subscribers. So, Robin, the app saved Ruby, and by raising awareness, she may end up saving many more.
I just love that little stretch at the end. I'm going to go ahead and turn our videos off just for buffering. I feel like I'm freezing a little bit, so we'll do that. But yes, that little baby Ruby stretch at the end. So before we kind of dive into the data and the research, one of the things that I wanted to do is just take a moment to define stillbirth. Stillbirth is the loss of a baby after 20 weeks of pregnancy. And on average, we lose in the United States around 21,000 babies every year to stillbirth. That's about 65 babies a day. So I just want to take a moment to recognize the tragedy of that and read this beautiful poem that we found by Michelle Salisbury. So, you were born silent, perfect, and beautiful, still loved, still missed, still remembered, every day still born, but still born. When we think about that 65 babies a day, one of the things that I wanted to highlight was the racial disparities that exist. So families are 6.5 times more likely to lose a baby to stillbirth than to SIDS, but we rarely talk about it. So what I want to do today and what Roxanne wants to do today is give you the tools and resources to be able to talk about stillbirth and stillbirth prevention, so that you do feel comfortable talking about this. So we can get to a point where we're talking about stillbirth prevention, just like you're talking about the Back to Sleep campaign and the importance of not smoking and not smoking around baby, that type of thing. That's our goal today, because 1 in every 175 pregnancies ends in stillbirth. And the racial disparities that persist are unacceptable. Native Hawaiian or other Pacific Islander pregnancies, 1 in every 94 pregnancies will end in stillbirth. Black pregnancies, 1 in 97. American Indian and Alaskan Native pregnancies, 1 in 128. Hispanic pregnancies, 1 in 205. White pregnancies, 1 in 211, and Asian pregnancies, 1 in 254. So you can see that Native Hawaiian, other Pacific Islanders, Black pregnancies, and American Indian and Alaskan Native pregnancies are 2 to 3 times more likely to experience a stillbirth over white pregnancies and white expectant parents. So we really have a lot of work to do to close that gap. And so thinking back to the demographic that you serve, making sure that you're aware of these disparities that exist. So that was national data. If we look at California specifically, we know that California loses around 2,258 babies a year to stillbirth. Your stillbirth rate is 5.08 deaths per 1,000 live births. While that's slightly lower than the US average, which is phenomenal, it's still higher than Iowa's rate, which is had a 32% reduction, which is what we want to do in California. So what we want to do in LA County and San Bernardino, so specifically with this funding, is decrease the stillbirth rate. We believe if every state, including California, if California were to implement Count the Kicks like we're doing in Iowa, we have the potential of saving 722 babies from preventable stillbirth. And I'll share a little bit later on how I got to that number and where that 32% reduction comes from. Now I wanted to share just a quick video on those racial disparities that exist and how we center equity at Count the Kicks and why it's important to us. So let's watch.
I am so blessed that she got here safely. And I'm so glad I listened to myself this time, and I listened to my body, and I counted my baby kicks. Count the Kicks just, I mean, it helped. It really did. It saved my baby's life. It really did.
She was like, it's a good thing you came when you did, you know what I'm saying? Because if you wouldn't have, you know, we probably wouldn't be having the same outcome. I think about it every day, like, oh man, what if, you know, what if?
So when we talk about the research and evidence, one of the things that I want to highlight behind our program, which is evidence-based, is this specific Norway study. And I know not all of us love reading research and journal articles like myself. If there's one in particular I want you to read, it's this one. And I want you to read this one, and it's on our website under evidence in our evidence section. And I want you to read this one because this is the study that started it all. And what I mean by that is we were founded by 5 central Iowa women who all experienced stillbirth or infant loss in the early 2000s. They didn't know each other at the time of their loss. They got connected through friends and pastors. And as they started, meeting for coffee and grieving together and sitting there thinking, wow, here we all sit with relatively similar stories, yet here we're getting told this is not that common. They were getting told things like it's like getting struck by lightning and just terrible things like that. And so long story short, a couple of the founders went to a public health conference where they heard some researchers out of Norway talk about a study that had been done where expectant parents were educated at 28 weeks on getting to know what was normal for their baby in terms of movement. And so within this cohort, the stillbirth rate decreased around 30% in this Norway study. The founders hearing this thought, wow, that's amazing. Just by giving people the tools and resources to know what was normal and get to know what was normal for their baby in terms of movement, we can truly decrease the stillbirth rate. Like that's our goal. And so we all know, you all know, kit counting's been around for a long time, but the tools and resources to easily and empowering talk about this have not. So they came back to Iowa. They looked at other research around fetal movement monitoring and worked with Iowa Department of Public Health to create what we all know and what you all know is the Count the Kicks program. Bright, colorful, evidence-based. Roxanne's going to go into a little bit more detail here in a little bit, but if you read one study, this is the one that I want you to read. Dr. Ruth Fretz, she was the only United States researcher on this study. She's now part of our medical advisory board as well. And so this is the one that started it all. So when you take that study and what the founders did is they created that Count the Kicks program in 2008, which is where we had that soft launch. So from 2008 to 2018, we had a 32% reduction in the stillbirth rate. In the first 5 years, like you saw in that video, we had about a 39% reduction among the African-American stillbirth rate. So this is the type of trend we want to see happen across the nation. We want to see this happen in California, but we need your help. So how did we get to that 32% reduction? We first just disseminated all of this print material. And luckily for you, thanks to our partnership with the foundation there, this material is free for you. So take a moment while I'm talking, while Roxanne's talking, we'll put the link in the chat to order materials. Just go click on order materials. When you go to checkout at the top of your screen, there'll be a coupon code option. Just enter the word Anthem, thanks to our funder, and you can get all this material for free, including shipping. So nothing will cost. You can get posters, brochures, app reminder cards as well. So take a few moments because I know we can all multitask and go check that out. Sorry, that video is going to play, but I'm going to skip over it for time. Maybe because I have another video. This highlights some of our more recent research. We were studied by some researchers out of the UK, prominent stillbirth researcher, Dr. Alexander Heasel, and we were recently published earlier this year in BJOG, which is the British Journal of Obstetrics and Gynecology. What a mouthful. But instead of reading that journal article, which I would recommend, but I know not all of us like to do that, we created a video to highlight some of the key pieces out of that study. So I'd like to share that now.
We know that there was no other sort of public health campaign going on in Iowa related to stillbirth at the time. And we know there's a relationship between the activity of Count the Kicks and the changes in stillbirth rate.
Prominent stillbirth researcher Dr. Alexander Heasel led the study that shows birth outcomes improved when moms learned about Count the Kicks.
And I think there was no doubt from the data that we saw a massive jump in the app downloads when there was a TV appearance. And I think ultimately as human beings, we are hardwired to listen to stories. You know, you can hear people like me talk about data all day long, and after a while, people's eyes kind of glaze over, and you can see that you've lost them. If you combine that with a story from a mum who kind of, you know, as you said, narrated how her experience identifying that her baby wasn't well because it wasn't moving normally, and then someone listened to her, took it seriously, did the tests that were needed, the test showed that there was a problem and the baby needed delivering, then that people listen to that and it touches them somewhere that numbers just don't.
Research shows that in Iowa, when more moms used the Count the Kicks app, more lives were saved.
Count the Kicks has had such an impact in helping mothers believe in themselves and believe in that they know what's happening within their own bodies, and then their ability to talk to a doctor in a way that they'll listen to, that the mom does know what she's talking about, because it gives them the tools to be able to show to the doctor when there's been a change in those kicks.
The Count the Kicks app is a data download for your intuition. Paying attention to your baby's movements is a great way to monitor your baby's health in the 3rd trimester. Download the free Count the Kicks app and get counting today.
So all the videos you see too they're all on our YouTube channel and they're all on our website. So feel free to use any of them as you go about. We know storytelling is really, really important. We'll talk about that here later on too. So here are just the QR codes if you'd like to read those research studies, the BJOG one that was just referenced. We also have a study in AJOG, which is the American Journal of Obstetrics and Gynecology, that talks about our app usage, our free Count the Kicks app, which Roxanne's going to go into more detail about here in a little bit. But just highlighting the fact that it helps decrease anxiety and increase bonding with baby. We also know that there's a connection between maternal mortality and morbidity and stillbirth. More than 15% of maternal deaths within days of delivery occur in a woman who experiences stillbirth. So if we have an opportunity to save baby from preventable stillbirth, do we also have the opportunity to save mom's life as well? We issued a white paper on this last spring, and so feel free to go to our website and read more about that connection, as well as firsthand accounts from American women who almost lost their own life, but because they were counting their baby's movements and knew the importance of counting their baby's movements, it was that decrease in their movements that really showed an issue with mom, so it saved both their lives. And then I think one of the top questions I get, especially from providers, nurses, is this just going to increase calls to my nurse line or calls or visits to the doctor? Which I have several thoughts on that, but one of them is, it does not increase hospital utilization. Talking about and educating on the importance of tracking your baby's movements does not increase hospital utilization. I'll tell you why in a minute, but this research study highlighted here says usually the fetal movement count is reassuring to pregnant women and prevents unnecessary visits. And so with our Count the Kicks app and that study that I just referenced, there has been 84% of our app users stated that regular tracking was associated with feelings of bonding, and 77% of app users reported feeling less anxious. Because now you have a highly educated individual that understands what's normal for their baby. They have data in their hands to show, yep, this is my baby's normal movement pattern, or nope, this isn't. It takes the guesswork out of doing that. So that's why there's really no increase in hospital utilization. We have not seen an increase in C-section rates or anything like that as well here in Iowa, where it's been implemented. And then finally, before we kind of jump into the implementation of the program, I wanted to highlight some of the other benefits that maternal fetal movement monitoring has that I don't think people think about. Things like it can be the reduction of preterm birth rate, fetal growth restrictions are identified earlier, because remember, this is a way baby communicates with mom. We talked about the stillbirth rate and the connection between severe maternal morbidity and mortality. But I think people are quick to jump to the conclusion that somebody comes in with decreased fetal movement, that's an automatic C-section. And that's really not the case most of the time, right? You do additional testing, make sure baby's okay, make sure mom's okay. So honestly, and for this research study stated here, it says due to the low cost and potential benefit, it, as in fetal movement monitoring, is recommended. Decreased fetal movement can indicate a need for more evaluation and has the potential to save lives. So I've done a lot of talking, so I'm going to take a break and throw it over to my friend and colleague, Roxanne, to talk about how to implement Count the Kicks.
Yeah, absolutely. First of all, thank you to all of you, birth workers, medical providers, nurses, midwives, whoever, doulas, whoever's joining us for this conversation. Just so thankful for what you do and how you care for patients. I know as a nurse, it's so difficult to talk about stillbirth with patients. So the rest of this is going to be kind of how do you have that conversation in a way that's helpful, in a way that just educates and empowers patients rather than makes them scared or nervous. So Count the Kicks is a stillbirth prevention campaign. It's evidence-based, as we've heard of the research that's been published, and it's mom-centered. So when the founders created this campaign, they did so wanting this to be an empowering campaign for expectant women. We all know how sad and hard stillbirth is to talk about, and I know this because I'm a nurse as well. And what the founders wanted to do is to create this campaign that would easily allow providers to talk about stillbirth and stillbirth prevention with their parents, and for expectant parents to understand what's normal for their baby and to speak up if they notice a change. So why does movement matter? We all, a lot of us are familiar with ACOG and how it recommends beginning counting at 28 weeks gestation or at 26 weeks if the person is pregnant with multiples or has a high-risk pregnancy. And so this research indicates that the baby can establish a consistent pattern that moms can feel and track at this gestation. So what counts as movement is rolls, kicks, jabs, swishes, pushes, anything that's like voluntary by the baby, except for hiccups. That's more like an involuntary movement. And that kind of feels more like rhythmic, spastic feelings if you need to kind of explain to patients what the difference is between a hiccup feeling and, the kick, rolls, jabs. And then this app is free. So let's talk about this a little bit more. The app has been downloaded over 200,000 times in over 140 countries. And there's no advertisements or pop-ups on the app to distract mom or slow her kick counting sessions. And we regularly survey our app users and listen to their feedback to make sure we're making any changes or improvements on the app. You can track twins with Count the Kicks. You can track future pregnancies on the same profile. You can manage multiple devices registered to your account, including like the Apple Watch. And then the app is free. It's also available in 16 languages, which is amazing. So some of those languages include like Haitian Creole, Russian, Spanish, Chinese, Vietnamese, and so many more. It's also available for app and Android. If you get interrupted, a kick if you accidentally tracked one. And then it's so nice too because it sends a reminder. The app will send a reminder for parents to track that day. As we all know, it's so busy, and so it's nice to get those reminders. Once parents start tracking, they'll notice a pattern for their baby, how long it takes for their baby to get to 10 movements, and then they can kind of figure out the norm for their baby. Nice feature the app also has is you can download it and share it with your provider. That way they can kind of notice as well and see that there are changes, if there are changes. And then let's see here. And then so there's another way that you can track too is you can get online, and there's on our website, and you can download a paper chart. So if you don't have internet, if the patient doesn't have internet, they can always download a paper chart and track on there as well.
Yeah, and I'll just add, Roxanne, too, that I think, you highlighted this, but the most important takeaway, I think, from this slide is the fact that we want parents to count daily around the same time each day. And that's where the app is really going to come in handy, because that's going to give them that visual representation. It's like that data download of mom's intuition or parents' intuition. So they tap the footprint, they choose that time, and then they tap the footprint, a timer starts, and then after they get to 10 movements, the timer stops, and they also get asked to rate the strength of their movements as well, because research shows not only should we be paying attention to how long it takes baby to get to move, to get to 10 movements, but the strength of those movements. And then the app, like I said, is kind of like that data download. And like you said, you know, you can share it with your provider, you can print it out, you can send it to like a MyChart or things like that. So it's really user friendly, completely free. So yeah, absolutely multitask right now and download the app is what I would say. So you can use it and get to know how to use it really easily. Go ahead.
Yeah. So also on the app and online, there's a way to find local resources. So there's a web or the free resource is called Find Help, and people can go there and enter their zip code and find free or low cost resources near them. And things are included such as like diaper banks, childcare, and more. So that's also a neat feature. The next thing we're going to talk about is just ways that we can talk about stillbirth with patients. And also just talking about health literacy so that we can do our best to educate them. We're educating all the time. And so it's always nice to have tools and knowing how to approach this conversation, especially since it's so difficult to talk about stillbirth. So the first thing would be to be equitable. So easy to assume certain things about patients. And so we just want to provide all expectant parents, no matter if they've had babies before, their backgrounds, their race, gender, religion, socioeconomic status, sexual orientation, marital status, or education level, even if they're another healthcare provider. We want to give everybody the same information. A neat statistic is that only 12% of US adults have the health literacy proficiency to perform complex health tasks. So higher education does not mean that there's high health literacy. So, and we probably all know that. It's just so important to give everybody the same information so they can make the best choices for themselves and their babies. Another aspect of this is to listen and learn and to ask strategic and open-ended questions about kick counting to help you assess what the individual patient understands, feels, and desires. So sometimes closed-ended questions can prevent conversation and actually create confusion. And so it would be better to just ask those open-ended questions about such as, tell me about your baby's movement. How is tracking your baby's movement? Can you show me your Count the Kicks graph? What questions do you have about your baby's movement? So all those are good things just to hear more about what that patient is experiencing and how you can kind of correct anything where they're not understanding. The next thing would be to be clear and concise, avoid long or complex explanations and medical terminology. I know for me, it's so hard to figure out how can I say this in a way that the patient's going to understand. And so something that's really neat about Count the Kicks is that the educational materials are parent focused, empowering, and easy to understand. Another thing is for us to be honest. It's hard, but it's really good to speak what's true while still practicing the empathy, and compassion. Pregnancy is full of so many risks, and we educate them about them. And so it's so important that we're including stillbirth in that conversation and how parents can prevent that. Just like we would talk about, risk for preeclampsia or risk for C-section or risk for intrauterine growth restriction. We can talk about stillbirth as well. Another thing is to ask for understanding. So it's super important just to make sure that they understand what you're saying and that they're repeating back to you what you had taught them. And it's great to use visuals like the brochure. So Megan provided the link to order brochures and posters. So it's really helpful to provide those visuals in the app as well. I like to put the app on my phone, and as I'm talking about this with patients or providers, to show them how the app works. So that could be helpful for you as well. And a lot of, Megan and I have moms that have experienced stillbirth on our team at Count the Kicks. And we've interviewed moms as well. And many of them say that they had a total lack of awareness that stillbirth was even a possibility. And so it just kind of goes to show how we need to talk about it, even though it can be really difficult to talk about. The next thing is to reteach. If the patient seems to be confused or doesn't understand, just to make sure that we're providing extra support to those who need it and to make sure that their needs are met and that they're understanding. And that's also why it's neat that the app is in many languages, so that if there is a communication barrier, they can still utilize the app for resources. So we're going to kind of go into a time of role play. Megan's going to act like my patient, and I'm just going to kind of respond so that we can talk about some common misconceptions
Yes. So I'm about 32 weeks pregnant, and I learned on Google and social media that I should really just get 10 kicks in 2 hours, and I don't really need to count my baby's movements. Is that right, Roxanne?
We actually have new research showing us that it's a better way to monitor your baby's movement is to see what's normal for your baby. And then our research is showing that with tracking your baby's normal movements, we can actually see if the baby is needing further evaluation or not, rather than those 10 kicks in 2 hours. If you start tracking and you find that is how many movements your baby make, if your baby does make those 10 kicks in 2 hours, then that's your normal for your baby. But sometimes it could take 5 minutes to do 10 kicks. So if one day the baby's doing 10 kicks in 5 minutes, and then the next day it takes 2 hours, then that's a reason to go get evaluated.
Yeah. And I'll just add, not as a patient, there is research on this too, again, on our evidence page, but where it talks about the 10 and 2, how it's what Roxanne said, it's outdated, and getting to know what's normal for your baby is best. The reason why, and I'll put this in my words versus reading a 10-page journal article, but basically what this research says is, as humans, as individuals, we focus so much on the time. So like, I know, Roxanne knows, we have 60 minutes to get through all this information. We're about halfway through, so we have about 25 minutes left. So I'm focused on that. So when we tell somebody 10 and 2 or 10 and 1, if I've been counting, let's say I've been counting my baby's movements for the last 2 weeks, and I get 10 movements in 15 minutes. And that's my baby's normal. It's been 15-20 minutes. I get my 10 movements in. And one day I count and I get 10 movements in an hour and 15 minutes. Well, what happens is the chart, if I'm using the app, that spikes up. So it's going to indicate to me that that's really not my baby's normal. My baby's normal has been around 15-20 minutes versus an hour and 15 minutes. So, but here I am sitting, maybe I'm a first-time mom or second time, whatever, but I'm getting told that as long as it's 10 kicks in 2 hours, it's totally fine. But what I need to remember is that wasn't my baby's normal, right? My baby's normal for the last 2 weeks has been around 15 or 20 minutes, not an hour and 15 minutes. So we don't want to get stuck on that time frame. That's why it's so, so important, and why we're really, really highlighting the fact that we want the patients, we want the parents to get to know what's normal for your baby. Like Roxanne just said, it could take 5 minutes, it could take 25 minutes. I've had 3 pregnancies. My son was 5 minutes or less. My daughter took 30 minutes. I went to triage 3 different times with her because I did not understand what her normal was. She just took forever. I was worried. I was comparing her to my previous pregnancy, and I didn't know about Count the Kicks at the time. The app wasn't out then, that type of thing. So 10 and 2, 10 and 1, outdated. It's all about getting to know what's normal for your baby. Okay, putting my patient hat back on now, Nurse Roxanne. And I also saw on social media that I couldn't get my baby to move. So I am going to go chug some orange juice and eat a Snickers bar. So if my baby's not moving, I should do something to make my baby move, right?
It's so important to see what movement is normal for your baby, because their movement is one of the first signs that their well-being needs to be evaluated. So a baby's movement pattern should be the same with or without something cold to drink or something sugary to eat. So it's best to have the baby evaluated if you feel like you need to do something to get the baby moving. And we know this because research has moved away from the idea that sugary drinks and the like are a good way to get babies to move. So it's best monitored without those interventions. And if the baby isn't moving like normal, it's best for you to go get that baby checked out right away.
Right. Because like you and I, when we're sick as adults or even kids, we conserve our energy, right? We're sitting down, we're resting, we're not chugging Mountain Dew. I've been told, parents have told me I should do jumping jacks, I should do this, we're conserving energy. Same with baby in utero. If something's going on with baby, whether it's infection, low amniotic fluid, whatever, umbilical cord, whatever it is, they're conserving their energy, or they honestly can't move because of a cord tangle or not, or things like that. So anyways, again, there's research on this, but like Roxanne said, their kick counts are best done without interventions like that. So we talked a lot about, I threw it in a lot, kind of preempting what this is going to be about social media. We know there is so much information and misinformation on social media, but sometimes there's some awesome information and truly educational and important. Roxanne in particular has been doing phenomenal work, and she's been on podcasts and blogs and everything like that. So the more correct information we can get out there on social media, the better. So anytime you can share anything that we have, anything that you see from Evidence-Based Birth podcast, all of those labor, what's the one, Roxanne, labor nurse, the one that was just on, any of those podcasts.
Yeah.
We'll send them. But
the Birth Story podcast.
Birth
Sorry, I had two
Story.
in my brain.
Yeah.
And then the blog was the VBAC link.
VBAC link, yes. And feel free to put those in the chat if you have time, Roxanne, so people can see those. But Jen Hamilton, I wanted to highlight, she is a nurse, labor and delivery nurse from North Carolina. She's really prominent on social media. So I don't know if y'all know her, but if not, follow her because she's hilarious. She like swaddles her chickens and teaches people how to swaddle chickens or babies using her chickens. But she has been a big supporter of Count the Kicks, and she recently, literally just within the last 48 hours, had done this post. And because of this one post that she did to her followers, we've had a 400% increase in app downloads. The power of social media is huge. And what we want to do is work with people like you who are educated on this, that know the facts, to share this information. I'm not saying y'all have to be TikTok stars or Instagram or whatever, but you could just share one post of something like this. So I wanted to share this. You're all the first presentation where I have embedded this. So let's hope it works. So let's watch what she just shared to her hundreds of thousands of followers.
Did you know that there's an app that can prevent stillbirth? Studies have shown that the most reliable indicator for an intrauterine fetal demise or stillbirth is a change or decrease in fetal movement. And getting to know your baby's movement and letting your doctor know if you have any changes is a great way to protect your baby. You don't need an at-home Doppler, and in fact, I would highly discourage you from buying one, because sometimes what happens is you can notice a change in your baby's movements and you can put on the Doppler and hear a heart rate and be like, everything's fine. And if you were put on a monitor where we could see what your baby's doing, we would see fetal distress. This is a baby that's doing great. This is a baby that might not be doing great. And this is the baby that's definitely not doing great. But guess what? Every single one of them has a heart rate around 150. And with just hearing a Doppler, we don't know which one of these is your baby. There's a free app that you can download called Count the Kicks. It is a way that you can monitor your baby's movements, and it'll help you figure out if you might need to go get medical attention. I don't work for Count the Kicks. I get $0 for telling you about this. I just think that this is genius. They were able to decrease Iowa's stillbirth rate by 32% in the first 10 years of the Count the Kicks campaign. So please, take a few minutes each day and just pay attention to what your baby's doing. And if your baby's doing something wonky that they haven't normally done before, come see us. We would so much rather you come in, we monitor your baby, we maybe do an ultrasound, and we let you know that your baby's doing okay, than for you to not come in and your baby not be okay. You aren't bothering us, okay? We want you to come in. That's what we're here for.
I love that. That's what we're here for. So yeah, absolutely feel free to share any of that. And again, this is being recorded, so you'll have access to all these. So as we wrap up, I want you to think about how you can connect the dots in your role, how you can integrate Count the Kicks into your system, whether you're a nurse, your triage, your community-based organization, telehealth, whatever you are, this is super simple. So ensure first everybody on your team knows about Count the Kicks. Share this recording. We'll send it out afterwards. Include Count the Kicks in your paperwork. If you have the opportunity and you do work in like a health system, can you include things in your triage paperwork, your discharge paperwork? We have examples, that gold standard examples that we can use. So feel free to contact me and I'm happy to get those to you. You want to discuss Count the Kicks every single time you see your patient or client in the third trimester. Consistency is key. We want people to see a brochure in their waiting room. We want them to see it in the bathroom. Then we want them to see a social media ad. And then we want them to see it at their library. And then we want them to hear it from you as their provider. So there's lots of ways that we can integrate this into our community. But I'm in Iowa. I can't do it in your county, in your community. So that's why we need you. So take the material, order it. It's free, and share it. Have some in your car when you're driving around. And then finally, just a couple last resources that I wanted to share. First, this is cute little Baby Save Eva. She's one of our Kansas Baby Saves, and I just absolutely love this photo. So I always use it. But one of the things that we wanted to share was we do have an opportunity for you to take a training for half off using that code right there. And again, this will all be sent to you in an email, so you don't have to like scribble this down. But this is our online CE training. It goes into a little bit more of the research. You get to read that wonderful Norway research that I talked about, but it also has a module on equity and DEI and how important that is because of the racial disparities that exist and persist. And what you can do to decrease those and merge that gap between white women and Black women and Asian or Pacific Islanders. So use that code half off to take the training and you get 2.25 CEs. And then again, you can order the materials. I put that in the chat, use the code ANTHEM. And then finally, storytelling is really, really important to us. I think you're going to walk away today remembering baby Ruby, probably Jen Hamilton. Share our video, share YouTube. And then finally, I think you're going to walk away remembering baby Nala. So let's watch.
She came back in after she had me put on the monitor and stuff, and she's like, we're just going to take her. And I'm like, what? And she's like, you know, her heart rate is dropping every time you have a contraction. I was already scared, you know, because I was a high-risk pregnancy. Well, I basically learned from the doctor's office, the little yellow sign that was right there. When she started moving, I was very alert with her movements, you know. That was what I lived for, just because I wanted her to, you know, her to make it and survive. When she started moving, she moved, and she was consistent. It was always at a certain time. Nala was a kicker. When she started kicking, she was kicking. And this day, she wasn't moving at all. I started drinking cold water. I mean, I was drinking so much, my stomach was hurting to make her move. And she didn't move at all for me at all that time. So I'm just like, okay, I'm gonna get her checked out. It was the heart rate that was dropping. Like they said, her heart rate would drop real low every time I would have a contraction, and they were like back to back. She thought that it would save the baby, so she pulled her out. She was like, it's a good thing you came when you did, you know what I'm saying? Because if you wouldn't have, you know, we probably wouldn't be having the same outcome. I think about it every day, like, oh man, what if, you know, what if? Definitely to pay attention to Count the Kicks, you know. I feel like it's important just because had I not, you know, knew to do that, Nala wouldn't be here. Don't second guess yourself. Don't feel bad or stupid. Don't worry about insurance or the emergency room bill. Go check on your baby, you know, because your baby might not be here. You just pay attention, you know, seriously. Like, it's your baby's life.
So that's it. Feel free to share those stories. Roxanne put in the chat the different links and information on some of those podcasts that we talked about. We're happy to answer any questions you may have. We're just so thankful for your time today. And look at that. You are 15 minutes. We are 15 minutes early. So happy to stay on, answer any questions. Otherwise, you're free to go about your day. We're super thankful for you. Roxanne, would you like to say anything else?
Yeah, just thank you so much for attending, and I really hope this is impactful and that you can utilize it in your practice. And I'm currently a labor nurse at St. John's Providence in Santa Monica. So if you're there or know of anyone there, I'd love to get connected and just share more. So thanks so much.
Thanks, Roxanne. Thanks, everybody. Do you have questions? Feel free to put them in the chat or Q&A. You're automatically muted. So you can raise your hand and I can allow you to talk. Otherwise, you're set. All right, not seeing any.